Good afternoon, everyone. This is Andy Reese, Director of Department on Disability Services. As always, we'll first provide an update on our data. So thus far in October, we have had 2 people test positive for coronavirus. Both of those people were vaccinated. So to date, by placement type, we have had 9 people in host homes, 114 in intermediate care facilities, 1 in a mental health facility, 62 in their natural homes, 2 in nursing homes, 4 in out-of-state placements, 41 in residential habilitation, and 213 in supported living placements. So in each of those placement types, the 114 people in ICFs represent about 38% of people in ICFs who have contracted COVID. Of those 114 people, 28 have died since contracting COVID. However, only 13 of those deaths have been confirmed as COVID related, reflecting about 11.4% of people in ICFs who contracted COVID who have a confirmed COVID related death. In natural homes, the 62 people represent close to 7% of people in natural homes who have contracted COVID. Of those, there have been 5 deaths. All 5 were confirmed as COVID-related deaths, representing about 8% of people in natural homes who contracted COVID, who then went on to die from COVID. In residential habilitation, 41 people have contracted COVID, representing also close to 38% of people in residential habilitation who have contracted COVID. Of those, 3 have gone on to die. Only 2 are confirmed COVID deaths. So that represents about 5% of people in residential habilitation who contracted COVID and have a confirmed COVID death. In supported living, to date, there have been 213 people who have contracted COVID, representing about 22% of people in supported living. Of those, 24 have died, but only 15 of those are confirmed COVID deaths, which represents about 7% of people in supported living who contracted COVID and have a confirmed COVID death. So overall, we've had 446 people who have contracted COVID. Of those, we have had 63 people who've died, but many of those have been confirmed as not COVID. We've had 37 COVID-related deaths, and that represents about 8.3% of people who contracted COVID and have a confirmed COVID death. So in the month of October, the 2 people, 1 was in supported living and 1 was in a natural home. And we have not had anyone who has contracted COVID since March who has required inpatient treatment for, since April, who has required inpatient treatment for COVID. We have had 1 death this month. However, of the 63 people who've died, as I indicated before, 16 are confirmed as not COVID related, and for 10 people, we are still awaiting the cause of death. So in terms of confirmed COVID deaths, the last time we had a confirmed COVID death was in April. I'm sorry. The last time we had a confirmed COVID death was in March. There were 2 confirmed COVID deaths in March of 2021. Among staff supporting people, 736 have tested positive for COVID. Among these, 52 have been reported as working for more than one provider, and 10 staff have died from COVID. Vaccination rates for people supported by DDA, 78% have gotten at least one shot. That includes 86% of people in host homes, 98% of people in intermediate care facilities, 63% of people in their natural homes, 96% of people in residential habilitation, and 87% of people in supported living. Amongst providers, staff, as of October 1, the reports that we have for provider staff who are fully vaccinated is 80%. And among DDS staff, the 91% of staff are reported as fully vaccinated as of today. So Dr. Sharon Lewis has joined us today. I know that she can't be here for the full hour. So for people who have questions related to the vaccination, the portal, reporting, and those issues, if you could ask those now so that Dr. Lewis can respond to them in the time that she has available with us. So thanks for joining us today, Dr. Lewis. And for people who have these questions, if you could type them, make sure that they are addressed to everyone, and Dr. Lewis is available to respond.
I also hope Dr. Bonita Jenkins may be on. If she is, we can address any questions that you may have as it pertains to TMEs. I did send her the invite, so hopefully she was able to join.
Yes, she confirmed right before we started that she was here. So I do see a question while we're waiting for people to type their questions regarding the portal. Total or TMEs, total number of cases was 446, which includes 2 people who have confirmed cases twice. So if you look at the monthly numbers, you'll see that they add up to 448. So for new hires, keeping in mind there's still a shortage, is it okay to hire if they receive a first dose and can start working while waiting for the second dose?
So based on the regulations that the emergency rulemaking that was signed yesterday by Dr. Nesbitt, it specifically states that as of October 1, anyone that's hired should be fully vaccinated. So if one has taken their first dose, and depending on whether or not it's J&J, they're done. If it's Pfizer or Moderna, then that's 21 to 26 days before the second dose. So you would need to wait until they have been fully vaccinated, which means 2 doses of the Pfizer, Moderna, 1 dose for the J&J.
How many DSPs have requested a religious exemption, a medical exemption, and how long do you anticipate that it will take to act on those exemption requests?
So I don't have a specific number for discipline. What I can say is that you can ask your employee whether or not they have submitted their attestation in the portal. Once you have uploaded, you will receive a statement that one can print out that indicates that they have successfully submitted or responded to the portal. It does not specifically say that one has asked for an exemption to be reviewed. We have indicated that also on the portal that we have provided DC Health 45 to, I believe it's 60 days to review all of the exemptions. I will say that we have reviewed a significant number of the WHO, that's the World Health Organization. That would be for those individuals that received a COVID vaccine out of the country here, or and those that have requested the medical. We have reviewed a very large number of those. Those for the religious, we have not started to review some of those. We've looked at some, but they're significant in number. So give us 45 to 60 days. So if you have someone that's asked for an exemption and they can show you that they have entered information into the portal and they're waiting for their exemption request, they will receive a letter from us indicating whether or not it's been approved, denied. In some instances, we need additional information, but that is limited.
Anyway, I'll read the questions without whether
Okay.
you just answered it or not. For people who have submitted exemptions through the portal, in what form is that confirmation received by the person? Because as providers, they're being told that the person received no confirmation of their exemption request. And if that isn't the case, does the confirmation include the person's name?
Okay, no, it does not include the person's name. That I didn't print mine out, so I'll admit to that. But anyone that went into the portal, responded to the questions, and clicked submit. Once they clicked submit, there was, I believe it's 2 sentences that are present. So that confirms that someone has successfully submitted their information, whether they're fully vaccinated or that they ask for an exemption. So that piece of paper in itself, they can take to their employee if they printed it out to show that they were successful in submitting their information in the portal. If they ask for an exemption, then that would be 45 to 60 days. They would not have a statement specifically that indicates that they submitted their exemption. Only the letter in response from us.
Regarding the new hires, do you have a link, or can someone provide a link? You indicated an order was signed yesterday.
Yes, yes. So let me look for it. Yes, and I can put that either in the chat, or I can send it to you or to Winslow, and you can disseminate it that way.
Perfect, thank you. What is the reason that DC Health is not requiring regular testing for those seeking exemptions or for those who have an approved exemption?
So we are not requiring, as DC Health, for regular testing. We would not be able to monitor the hundreds of facilities within the District of Columbia, but you, as the provider, can require weekly testing. So you have that option to do so. If you have someone that is working in your facility that has an approved exemption. Right now, you don't have an approved exemption, so during the interim, my thought is that you would want to make sure that your clients are safe and that you implement the process that you can do your best in ensuring that in your facility. I'm calling it facility, but I know they're the homes.
This is saying there's no confirmation emailed to the person. Could we place their documentation from their doctor in their file in place of their vaccination card?
Repeat that again. The confirmation from their physician. You're talking about that they have received the vaccine, or that they have requested an exemption?
I assume that they have requested an exemption.
Oh, yes, that can be placed. That's fine. If that person wants to make their personal information available to their employer, yes, they can put that in their file. And then keep in mind that 45 to 60 days out, that they should checked with their employee to see if they have received an approval or denial letter from us.
And keep in mind, because you will have provider certification review from DDS, if that were upcoming, you would want to make sure that you have documentation that you have ensured that all of your employees are compliant.
And that
Because
is
there is a
correct. And we're
requirement
doing
for the
so as well.
agency.
That is correct. And thank you for that.
Those who submit exemptions, are they to remain out of work until they get a response? Now, we have a written response from DC Health 2 weeks ago that said, no, if they've submitted the request, they can work until they get a response.
That is correct. That is correct.
If a new hire is requesting an exemption, would they be allowed to begin work while awaiting an exemption?
So once again, anyone hired after October 1, they should be fully vaccinated.
But if they've requested a medical exemption,
so they're not fully vaccinated.
Okay, so they can't. Are you? Oh, well, I'll have to see what this order that came out yesterday says. You're not suggesting that people are not allowed to have medical or religious exemptions anymore?
No, that's not what I'm saying. If they have an approved one, yes. But if I understood the question, the person is asking, can they hire someone who's not vaccinated to work in their home or facility? You don't know whether or not they have, one, submitted the attestation to us. So we've connected those individuals to anyone that's not licensed, certified, or registered by us did have to indicate where they're working. So we're taking that they're still working where they indicated in the system, as we are taking the time to review their request for exemption. And again, we're saying that's from 45 to 60 days. So what this person just asked, can they hire somebody who's not vaccinated? Even if you look back to the August 27th date of that rulemaking, it makes reference to people being vaccinated by the end of September 30th. So effective October 1, with any new hires, those individuals must be fully vaccinated. Also keep in mind that we're waiting to receive information from CMS. And, CMS's position is the same, that individuals must be vaccinated, but we're waiting to receive that directive in writing. We have not yet received anything in writing from CMS. So we want to make sure that everyone does not put themselves in a position where they will be in trouble later on. Let me see if I can pull up that
Thank you.
regulation that I just
Meanwhile, there's a TME question. So,
great.
Regarding the TME process, there are persons who have applied as a TME who have not received a response from the Board of Nursing for months. Was it the plan to catch up? Is any person who reapplies for TME status deemed eligible to continue working in that role until they hear back from DC Health Board of Nursing?
Yeah, I think Dr. Jenkins can take that, and as well as Dr. Jenkins, if you can explain those things that you have observed where people indicated that they've had some challenges.
Okay, good afternoon. It seems that maybe some applications, some paper applications that were submitted between April and May were caught up in our transition to the online application system. So there is really no way for us to know those that may have been mailed in as paper and not really have been transferred to our online system. So I'm going to ask for someone to submit the names of those persons to me, And then I can check and get back to you. And I'm assuming these are initial exam or endorsement applications. For the renewals, we have been having issues with persons logging in as a new user because they forgot their email address previously used, maybe in 2019 renewals. And then the system is treating them as a new person. And so therefore we cannot, they do not see the renewal page. So for those persons, again, if they've forgotten their email address, they are going to have to contact Board of Nursing staff. And I'm going to ask them to contact myself or Kathy Borshill so that we can change their email address in the system and have them log in using whatever email address they have access to. But we have to change it in the system so the system does not treat them as a new user. The renewal page will not come up for a new user. Hopefully that helps.
And the other thing, I think that, like you said, Dr. Jenkins said, when people enter into the system, they really have to pay attention on what they're clicking so that they're not creating a new profile and actually clicking on the correct icon for renewal. So let me, Director Reese, is there a way that I can maybe share? I just sent to you or if you want to, I just sent to you the vaccination requirement and the rulemaking that was signed, emergency rulemaking that was signed yesterday that is to be published in the DC Register. And it says here under 11200.1, no healthcare facility may or after October 8, 2021, hire, employ, contract with, or grant privileges or credentials to, or continue to employ, contract with, or grant privileges. And then it continues on that they must have received their first dose of Moderna vaccine on or before September 30th and received their second dose of the Moderna within the time period established in the dosing schedule. So this is now October the 8th. So if someone received their dose on September the 30th, then they would be due to receive their Moderna dose around October the 21st or so. The latest around October the 26th. So I guess I would stand corrected. So if someone that's hired and if they've received their first dose and they're due to receive their second dose by, let's say, the end of October, then they will probably be okay. Do you see the document that I sent to you? It also
I put it
requires,
in the chat. I'm sorry. I put it in the chat for people, they can download it.
okay. Any questions?
Yes, so if they have a licensed consultant whose license is still valid and they decline to submit their vaccination card, so it's someone whose license doesn't expire until 2022, is their current license still adequate proof of compliance with vaccination requirements?
Okay, so if I understood that, if someone's license is good until 2022, but they do not want to submit their vaccination card, in other words, you don't know their vaccine status, is that my understanding?
That's what it appears, correct.
Then you have no way of knowing whether or not the person meets the requirements of rulemaking. They should be able to provide you with a copy of their card, their vaccine status. Now, individuals who are not vaccinated by a certain date, of course, we're looking at all of those individuals. So if they're licensed in the District of Columbia, we're looking at all the individuals that either failed to respond in our portal, as well as those that are not vaccinated and with no intention of asking for an exemption. Of course, the fact that one has asked for an exemption doesn't necessarily mean that it's automatically approved. It will be reviewed. So
And if we have Dr.
definitely want
Jenkins'
to know the
email,
fact.
can we post it in the chat, please?
Pardon me?
If someone could post Dr. Jenkins' email in the chat. Charlize, we invited her, so we have her email as well. If anyone can just type that into the chat. So to confirm, those who only got one dose months ago, but didn't go back for their second dose, they cannot work after the end of October.
Well, my hope is that they would be communicating with their primary care physician or someone to see how they can then, what would be appropriate for them as far as their pathway in becoming fully vaccinated.
So someone is asking the question again about a new hire, and I do think it matters when they were hired.
Yes.
So they're asking, so a new hire submitted an exemption letter to DC Health and showed proof to the provider that they're applying for the exemption. They've submitted their exemption by providing two-line statement they've received once submitting an exemption request. Can the provider hire the applicant while pending approval, and the provider will require weekly testing?
Based on my read of this document, I don't see that you can, but let me check with Philip Husband, our attorney, and I can get something back to you. And the question is, can someone hire someone like today? Today is 10/8, so this says no healthcare facility may or after October 8th hire, employ, or contract with, or grant privileges to. That's what this document says. So I would think that the person needs to print it out. But what they're asking is, and it talks about that the person should have received their first dose of the vaccine. So this person that's asking this question is asking for someone who is not vaccinated. Who is not vaccinated and asking for an exemption consideration. Can they hire that person? Based on this, it does not appear that they could, but I will double check with Mr. Philip Husband. And again, if you look at the very beginning where it states vaccination requirement,
And I just emailed the document to all the participants of this meeting because for some reason I couldn't post it where you could open it up. So if you check the email that you used to receive the invitation to this call, I just sent the link to you. I mean, the document to you.
And I'll get back to you this afternoon.
So this says that I believe a consultant is asserting that they're vaccinated and still licensed to perform their job, but refusing to provide documentation.
Yes, but then you have no evidence. And this document also indicates that you must, let me see if I can find it in here. It talks about facilities maintaining their documentation on your employees. Yes, so that's further in on 11202.2. A healthcare facility shall require each of its employees, contractors, volunteers, and it goes on, to provide written proof by the dates set forth, and that's in the document early on in the document, that they have received the required COVID-19. So if the person is not willing to provide you with that evidence, then I'm not sure how you can maintain documentation to support that that person has received their COVID vaccine.
And Dr. Jenkins' email is posted in the chat for people. It's bonita.jenkins@dc.gov. We need clearance on new hires. If someone had their first dose before hire and shows proof, does that mean they cannot be hired until fully vaccinated?
Okay, so once again, if let's see, if we go to this document, and it'll be helpful if they, I don't know if they have more than one monitor, but if it would be helpful if they would be able to open the rulemaking that was just shared with everyone. And it's under vaccination requirement. And it talks about no healthcare facility may, after that October 8th, hire someone if they have not received their first dose of their Pfizer or Moderna on or before September 30, 2021, which means that their second dose of the Pfizer or the Moderna should be administered within the time period for that particular vaccine type. Does that help?
I believe so.
Okay.
And I mean, so if the person isn't clear, they can type in for further clarification.
And you can reach out to me, yes, or if you want to channel the questions to one person and Winslow or someone can send them to me, then that's fine.
That'll be great. Someone asked, are there minutes of these meetings available online? Yes, there's a transcript. There's this meeting is recorded, the video, as well as the PowerPoint are all online on DDS's website. So no, it does not. The question is, can they work after the first dose? And I would just refer you back to the regulation, read it, review it with your agency counsel.
Yes.
I'm sorry, I did try to send it to over 1,000 people, but apparently I'm limited to 500. So I've asked Charlisa, who may have the ability to send it to more people than I do, to send it out.
Yes. But your numbers, if I remember correctly, looking at your numbers, I thought your numbers looked fairly good as far as the employees being vaccinated. I thought I only saw one number that might have been low. Is that not correct?
We're at 80% for provider staff.
Yeah. That's pretty good. Let's keep
It's come
pushing
quite a
with it.
ways recently, so yes.
Yes.
And that's fully vaccinated, so it doesn't account for folks in the last 2 weeks who may have gotten their first shot, or the
Yes.
last few weeks who might have gotten their first shot.
Yes, so please continue to encourage your staff, because I think if all of us are looking at what's happening in the landscape, even nationally, it's the wave of people do need to be vaccinated. So just take that into serious consideration. And if anyone has not gone into our portal and have not completed their vaccine attestation, it's still open, please do so. The last time I looked, we were at about 50, let's see if I can go into it. We were at about 50 plus thousand. Let me see, excuse me. Just gonna refresh. So as far as the number of fully vaccinated, I know it's over 52,000 for our licensed individuals, and those that are fully vaccinated, I know that it's over 13,000. Those are just rough numbers without doing the complete math. So I'm sure there's still a number of people who are unlicensed that have not submitted their information in the portal. Also, if you have any friends that are licensed, certified, or registered and may not be actively working in a clinical setting, they still need to submit in the portal. So if they're retired and still licensed, people that you may know, they still need to submit their information in the portal.
How are boosters going to figure into the status of fully vaccinated, or does it not? Just
So at this,
asking because they don't want to start all over again with tracking.
yes, so at this time, we have not factored in the booster. My recommendation would be, if you have staff that are getting the booster, add that to their file, add that information to the file. But at this time, we have not put out any rulemaking or any narrative as it pertains to that we will be tracking the booster from the regulatory standpoint. Of course, we want those that where it does apply for them to receive their booster.
So,
Director Reese, this is Mel. I
yeah.
can also add that currently the CDC has not incorporated boosters into their definition of fully vaccinated. And so until that happens, our recommendations and our definitions of what fully vaccinated is would not change unless that happens. And so it's still unclear how or if the CDC will update that definition.
Thank you.
I will say that we are beginning to, have some just general conversation to make sure that people are preparing for those that it would apply to in our long-term care setting to begin those conversations. But as Nelson, that was Nelson, I believe, that did indicate that, yes, we don't have anything in writing at this time.
So for providers who are authorized to provide a service through a service funding authorization with DDS for a person to whom they're providing residential supports, will DC Health be verifying their vaccination status? The question was, will DDS or DC Health? I'll answer the DDS, but I'll allow you to answer. Is there anything DC Health will be doing to verify their vaccination status?
And are these contract workers?
No, this is for providers. Are there steps that are being taken to review the vaccination status of the provider's staff?
So as the survey teams are out conducting whatever type of survey it is that they're assigned to at the time, may it be a licensure survey, a complaint survey, or a recertification survey, they are looking at documentation in those provider types. So they're looking to see what you do have on file, how you've maintained your tracking, and what you have on file.
And as we've said before, the same goes for DDS. We have provider certification reviews. And as any new regulation is passed that affects provider qualifications, they incorporate that into their review. So they will be incorporating that into the reviews that are done in October. You noted that the emergency regulation applies to healthcare facilities. Are we clear what type of settings are deemed healthcare facilities under this regulation? And rather than read that whole section, I emailed it just to you, Ian. But we are trying to email right now to everyone on the call that regulation so that you can review it for yourselves. Oh, this is transcripts for the forum are furnished upon request. So I assume that means we're not doing transcripts given that we have a videotaped recording of the forum, but I'm pretty certain, since it says we're recording every time, that these are placed on our website.
And I have one question to follow up on if my notes are correct.
I don't understand, Sawita, your comment, separate authorizations, what that is referring to. So if you could, I meant we're a residential provider. Some of the people we support receive other services through authorizations from other providers like PT, OT. Is DC Health or DDS verifying the vaccination status of other providers that support the people that you provide services to?
So what I'm going to say to that is that as a business, then you would be looking at those that are coming in and providing that service to your clients. So that would be incumbent on you to make sure that your clients are being provided those services in a safe setting. So if you need, you would need to then ask those questions of those individuals coming in. Now, if you ask whether or not DC Health will be looking at documentation when we come out to do the surveys, yes, we'll be doing that. If you're asking whether or not we're looking at each and all licensees to see whether or not what their vaccine status is, those licensees that are licensed in the District of Columbia, we have information whether or not they have submitted their vaccine status or have not submitted their vaccine status in the portal, and whether or not they've submitted their vaccine status and have requested an exemption. So we're working through all those three groups, if you will.
For TMEs, it would be much easier if staff can resend their own passwords instead of the TME emailing or calling the Board of Nursing. Also, it would be helpful if the system permitted the CE certificates to the system, then email to a person at the Board of Nursing.
So I will comment on that. If the person is using their same email address as their username, the same one they used in 2019, then there's a link or button in the online renewal system that says, I forgot my password. They can select that and then they will get a password reset. That they can select only one time per 24 hours. If they change their, I'm sorry. I thought someone was saying something. If they change their email address, they have to, and it's probably best if they email us. I'll also, I gave you my email in the chat. They can email me, I can change it quickly to update their email address. They cannot do a password reset if they change their email address between the last time they were in the system to renew, which was 2019, and now. We have to change it. And it's easier if we do it, staff does it, rather than wait for IT to get to it. So those are the options. I think it was the second part to that. I'm not-
About CE certificates?
Okay, so they should upload, attach their certificates in the education section on their renewal page. So they would need to have an e-copy or the CE somewhere where they could upload it during their renewal. We do not accept mailed, so they should not be mailing, no one should be mailing any additional documents to the Board of Nursing. Now for new TMEs, they may be mailing something to the health licensing specialist. So I'm only referring to renewals. For renewals, the CEs are uploaded into the online renewal portal. Everything is online now.
And so just to bring people's attention to it, there are two things that have been posted in the chat. Person asked about where they can find the recordings on our website, and there's the link for those recordings in the chat. And thank you very much. Morgan has also provided the link for the emergency rulemaking that we've been discussing, and that's in the chat as well. Before we end, can you comment on the retainer payment, any update on how things stand, and an update on the transmittal that will go out? So yes, as people can imagine, this retainer payment is a little bit more complicated than the prior one, because the prior retainer payment, we already had the authorizations in place. And so it was just a matter of providers submitting claims for services that were authorized but could not be utilized because of the pandemic. Now we're here, it is a year and a half later, a little more than that. And some of those authorizations were ended by the service coordinator and the team because the person was still, not returning to that service. And there was no indication at the time that we would have another retainer payment, which we now have. And so what we're going to need to make sure that is done, and we're working right now to make sure that that's as smooth a process as possible, is first of all, to remind people retainer payments are available going back to January 1, 2021. And each person receiving services can get 90 days of retainer payments. It's important to think about that now because only 90 days can be paid, and that's 90 days per person. And it may be, for example, given the time that has passed, a person may have started with a new provider in July getting day services. And if that's the case, the prior provider could still be entitled to January 1 through, it's about the second week of May, gets you to 90 days of service. If the person had previously, as in, March, April of 2020, had an authorization for 5 days, 30 hours a week of retainer payments with a particular provider, then, and in January 2021, they were getting no services, then they could get that authorization. The service coordinators will authorize those. We're working out the process to make sure that we are processing all of those. We're working between waiver and service coordination to make sure that we have a smooth process with those. And so I expect the transmittal will go out next week explaining what that process is so that providers can do that. The other thing to keep in mind is that there is the possibility that a provider could have begun providing services to a person 1 day a week. And then, starting in February or March. And so they are still entitled to 90 days of retainer payments if it is that the reason for the retainer payment is that they had previously been authorized for more services than they are now able to provide because of the pandemic, with the exception if the person is receiving day services from another provider, then those can't count toward a retainer payment. And so, there's those complications in there, but the bottom line really is, yes, the transmittal will go out next week, and the keeping in mind that it starts January 2021 and 90 days of service. I haven't done it exactly, but it gets you to about the middle of May. And unfortunately, given the way that this pandemic has gone, for a lot of people, that did mean that they were still not back in day services yet. But to the extent someone resumed day services with a provider, if they were able to resume part-time for a variety of reasons, as long as the reason for it was not, well, I'm doing something else on those other days, and that previously they had been authorized for 5 days. So if they came to a provider 2 days a week for services a year ago, and they're back with them 2 days a week now, you can't get retainer payments for the other 3 days because the only thing you really lost out on was those 2 days. But you can get 90 days of service. You can get up to 90 days of service for service that could not be provided due to the pandemic. I hope that long explanation was clear. And I also want to provide an opportunity for Nelson just to briefly talk about. I know there's been some updates posted on DC Health, on coronavirus.dc.gov's website, some updated guidance, and I don't know if people have seen it yet, but I always go in and just check the dates to look at the new ones. But if Nelson would like to share, particularly there's guidance that related to eye protection.
Thank you, Director Reese. Real quickly, there are several documents effective October 1st that can be found at coronavirus.dc.gov/health-guidance that were updated that you should review. The most important is the changes to recommendations for eye protection and the change in language. Previously, there was some phase language that required eye protection during patient encounters during phase 2. As we are getting out of that phase type language, we are bringing our recommendations in line with CDC to state that during patient encounters, when healthcare providers will be within 6 feet of patients or residents while inside the healthcare facility, while DC has substantial or high levels of community transmission, as reported on the CDC COVID-19 data tracker for at least 2 weeks. Staff must wear eye protection during those times. And if you also recall, there are also statements in the setting-specific guidance that state that direct service staff must follow guidance for PPE that's outlined in this healthcare facility setting document. So that would apply to them. The new guidance also says that if the level of community transmission in DC decreases to moderate or low, that eye protection in those instances is required until that lower level of community transmission has been maintained for at least 2 weeks. So it will be up to providers to monitor the level of community transmission on the CDC data tracker to determine when eye protection is indicated in those instances. Even during low levels and of community transmission, just a reminder that eye protection would still be required during standard and transmission-based precautions, and also when caring for someone with suspected or confirmed COVID-19 infection. So please take a time to review that guidance as it may affect your workflow. Thank you.
Could we advise, oh, sorry. When will DDS send a transmittal regarding Station MD? The launch for Station MD, I'm not sure what the date is, but we'll provide guidance about the equipment that we'll be providing when it is launched and when we once we have that information. It's not forthcoming in the next week or two, I can say that. And if someone has a more current update, please provide that. Who can providers call or email to get a better understanding of the updated retainer payments? I would suggest, as I said today, a transmittal will go out next week. The transmittal will indicate at the end if you have questions whom you should contact. So I would suggest waiting for the transmittal that provides the guidance and then follow the guidance in the transmittal about whom to contact. So I see it's 1 o'clock. I really want to thank, I know that Dr. Lewis didn't have the whole hour, but certainly seemed to stay for the whole hour. So I really appreciate that. And there's one last question here. So I don't know if she's been able to stay. I think the concern with new hires and the vaccination requirement is that the orders were written for current employees and does not have a clear regulation for new hires after September 30th or October 8th. We would appreciate if DC Health could allow a new hire to be allowed to start working if they've received their first vaccine and have not yet missed or are not yet due for their second vaccine. Should they then miss their second dose, we would have to let them go. Again, there's a shortage, and waiting for another 2 weeks, 2 to 3 weeks, is really a burden. The best option for an employer would be to get the Johnson 1, for an employee, would be to get the Johnson 1 dose before hire, and they would be good to go. But if not, it is really difficult to keep up with the demand. I mean,
So I can appreciate the comment, and I was trying to see if I could get an answer to that one question while you were meeting, but Attorney husband is in a meeting at this time, so I wasn't able to reach him, and that was about hiring a person. Can one hire a person that is asking for a COVID exemption? So I know I have that as a question that I need to find an answer for. You will get back to you with an answer. But once again, I will ask people to acquaint themselves with the recent emergency rulemaking that was signed. And I think under the vaccination requirements section, it kind of clearly details what you would do as far as bringing a new person onto a facility. And again, it says no healthcare facility may or after October 8th bring anyone on that has not had their first dose. And of course, the pending second dose.
And just so people know, that's the same, for district government, as soon as the mayor's order came out, effective, it was about August 14th, we couldn't hire any new people who were not fully vaccinated. And so immediately had to get vaccination status with the potential for delaying employment for people. So
yes,
hopefully as these mandates spread, the issue of whether people have been vaccinated will be less and less of an issue. As Dr. Lewis commented before, and we note in our vaccination data, our providers have really come a long way. They're, fully vaccinated at 80% as of a week ago. Our own staff is just over 90%. So I think, the best for all of us really is to continue taking all the measures we need to take in terms of, making sure that we're still masking and getting vaccinated so that we can keep ourselves and the people around us healthy and safe. So with that, thank you from DC Health for joining us today. And we will talk with folks again next week. Thank you very much.
thank you, Director Reese. Thank you. Thank you all.